So many of you likely have goal setting, maybe even incentives tied to some of these questions that are being removed. And that's going to be really an important consideration as to how you carry that over, what your timing of that is. Obviously, those are internal discussions you need to have. The other part of it, though, is really the new questions that are going to be asked. Now, goal setting in general, we have several recommendations, but the question we always get is, well, what are my scores going to be? What goals should I set on these questions? What's a really good goal for these questions? And the difficult thing for us to say is that we don't really know, because there are implications, right? That factors that come into play with your patient population, the communities you serve, that are going to impact the data we get back. The other thing I already mentioned a little bit, but I'll reiterate, if you're adding a modality you've never utilized, i.e. web, to the mix, well, you may get a respondent population that's a little bit different than what you're used to getting as well. So that may impact some of your data as well. So the difficulty we have in predicting those scores is great. The other thing, though, is that we always want to set goals based upon your own data. So the best practice would be to have a baseline of information, best practice of 90 days or 3 months worth of data that you can take and utilize and say, well, this is really how I'm performing on these metrics. Here's the goal I'm going to set. That way it's accurate. It's something that you can hit. If it's a certain time of year, if it's impacted by seasonality in the patients that you see. And that's really going to be important, so you don't set yourself up for failure or success either way by setting a goal that's either too high or too low. So it's definitely something to consider as you look at goal setting, and that's something that we can be a resource on.